Your dog sleeps more than he used to, eats a little less, and takes the stairs slower than last year. Doctors see all three of those on a cancer chart, and almost no owner ever makes that connection. Here's the part that throws people off. These signs don't look dramatic. They don't look like an emergency. They look like Tuesday, like a dog who's simply getting older. And that's exactly why they slide past so easily, right up until the day they don't. If you're already running back through the last few months in your head, wondering what you might have missed, let that go for a second. You didn't miss anything because you weren't paying attention. You missed it because these signs were built to hide inside something that looks completely ordinary. The fact that you're watching this right now, trying to get sharper about it, already tells you what kind of owner you are. Aging is real, and most of what your dog does differently at 9 or 10 is exactly that, just age. A slower morning, a little more sleep, a coat that isn't as glossy. None of that is a red flag on its own. Think of aging like a dimmer switch. Everything fades down gradually, evenly, over months and years. What we're hunting for today is different. It's a change that happens out of tune with that slow fade, a piece of it dropping faster or harder than the rest. And that mismatch is usually the tell. A tumor, in the simplest terms, is a group of cells that stopped listening to the body's stop signal and just kept growing. That's really all the biology you need. That growth can sit quietly and barely bother anything, or it can start pulling energy the rest of the body needed, pressing on a nerve, sitting somewhere it shouldn't. And that's when you start seeing it on the outside, in the 7 places we're about to walk through, one at a time, starting with the one almost every owner waves off first. Sleeping more sits right at the top of the mistaken for age pile, because senior dogs genuinely do sleep more, sometimes 14 hours a day, and they're slower to get up from a nap than they were at 3. That part is completely normal and nothing to worry about on its own. What crosses the line is different in shape, not just in degree. A dog who's hard to rouse even for dinner, who skips the walk he used to beg for, who seems tired 20 minutes into a short stroll instead of after an hour. That's not the same dimmer switch fading. A tumor is metabolically expensive. It pulls fuel the rest of the body needed, and that shows up as an exhaustion that rest doesn't really fix. A useful habit here, and it costs nothing, is noticing roughly how long he naps and how easily he gets up for the things he loves. Then watching whether that pattern is sliding week over week or just having an off day. Size plays a role here too. Big dogs, the Labs, the Shepherds, the Rottweilers, tend to age into more joint stiffness earlier, so their owners are already primed to explain slowness as arthritis, sometimes correctly and sometimes not. Small dogs get the opposite blind spot. They're carried more, walked less far, and a drop in energy can hide inside a lifestyle that was already pretty low-key. Neither size gets a pass. The same rule applies either way. Watch for the pattern breaking from its own baseline, not for a number on a chart. Appetite works the same way. Older dogs get pickier, that's real. They might leave a little kibble in the bowl or take longer over dinner, and that alone is nothing to chase. What's worth paying attention to is a drop that keeps going, walking past a favorite treat, skipping full meals more than once or twice, especially if it's paired with anything else on this list. Cancer can blunt the hunger signal directly, or a mass sitting in the mouth or throat can simply make eating uncomfortable. And either way, the fix isn't a fancier food, it's getting the reason looked at. That's usually the point where owners start wondering if they should say something out loud instead of just watching quietly. And honestly, that instinct is worth trusting. If any of this is landing close to home already, go ahead and drop a comment telling us which sign you're watching for right now. Hit subscribe if you want more of these breakdowns, and a like genuinely helps this reach other owners who are missing the exact same thing in their own dog. It costs you nothing, and it might put this in front of someone who needs it today. Now here's a sign that trips people up more than almost any other, because it comes and goes. And anything that comes and goes feels like it can't be that serious. A limp that shows up after a nap and eases once your dog gets moving, that's often just stiff joints. Arthritis doesn't love cold mornings or long naps, and it tends to loosen up with gentle movement. That pattern, worse at rest and better once he's up and walking, is the ordinary version. What's different is a limp on one specific leg that doesn't fully resolve, that's worse at night instead of better, or where you can find a spot on the bone itself that's warm, swollen, or sore to a light touch with no injury to explain it. Bone cancer, something vets call osteosarcoma, tends to grow from the inside of the bone outward, which produces a deep localized pain that doesn't behave like a stiff hip. It's far less common than ordinary arthritis, so this isn't meant to scare you into panic over every hitch in his step. It's meant to help you notice when a limp is acting like an outlier instead of a pattern. Picture a dog like Luna, a 9-year-old retriever mix who started favoring her back left leg on and off for about 3 weeks. Her owner chalked it up to getting older, gave her a softer bed, figured it would pass. It didn't fully pass. It just came and went, a little worse some days, and eventually she brought it up at a routine visit almost as an afterthought. The vet felt a subtle firmness along the bone that a hip alone wouldn't explain, and the imaging a vet typically orders in that situation caught something small and early enough to matter. In cases like that, catching it while it's still small is often what changes what's actually possible, and that decision always sits with the vet examining the dog in front of them, never with a guess made from the couch. Weight loss is the sign that fools people the most, because it usually shows up as your dog just looking a little leaner, and leaner can look like healthier if you're not paying close attention. Some weight change with age is expected. Older dogs lose a bit of muscle tone even on the same food. That's normal. What isn't normal is weight dropping while he's eating the same amount or more, because that mismatch means the body is burning through fuel faster than it's taking it in, sometimes eating into muscle to keep up with what a tumor is demanding. You won't catch a slow drop by eye most of the time. Your hands see it before your eyes do, and running a hand down his ribs and along his spine tells you more than a glance across the room ever will. Weighing him once a month, even on a bathroom scale by holding him and subtracting your own weight, turns a vague feeling into an actual number you can bring to your vet. It's worth saying plainly, none of these 7 signs live in a separate box from each other. A dog losing weight quietly is also more likely to be the dog who's sleeping more, because the body is spending its limited fuel keeping essential organs running instead of powering play and long walks. That's why one sign alone might mean very little, but 2 or 3 showing up together in the same few weeks is what tends to move something from probably nothing to worth a proper look. A lump that grows or changes color, shape, or texture deserves a look, full stop. But let's be honest about the odds first, so this doesn't spiral into panic. Most lumps that show up on an older dog, somewhere around 80% by most estimates, turn out to be harmless fatty lumps or cysts, nothing that needs treatment at all. That number should bring you relief, not dread. Here's the catch, though. You can't tell the difference by feel alone, and neither can most owners, which is exactly why every single one still deserves a check rather than a guess. What tips a lump from probably nothing toward worth a vet visit soon is change, one that's getting bigger over a few weeks, one that used to slide freely under the skin and now feels stuck to what's underneath, or one that changes color or starts to ooze. Size matters less than most people assume. A lump the size of a pea that's changing fast is worth more attention than a golf ball-sized lump that's looked exactly the same for 2 years. A simple habit that costs 2 minutes a month is placing a coin next to any lump and taking a photo, so growth shows up in pixels instead of memory, which tends to lie to us about slow change. There's a mistake almost every owner makes somewhere on this list, and it's worth naming honestly. It's the wait and see, give it another week, he seems fine attitude, which feels responsible in the moment, but usually just delays the one thing that actually helps, an early exam. And if a limp tempts you toward the medicine cabinet, hold on, because human pain relievers like ibuprofen, naproxen, and even plain acetaminophen are genuinely toxic to dogs, sometimes in small amounts, and they belong nowhere near his bowl no matter how much he's favoring that leg. If he's sore, the safe next step is your vet, not your own bathroom cabinet. And that's really the whole shape of this list, isn't it? One sign quietly pointing at another. The limp that came and went, the lump that's just a little different than last month, the appetite that's dipped. None of those sit alone in most dogs. They tend to travel together as pieces of one larger picture that only makes sense once you're looking at all of it at the same time, instead of one worry at a time. That's actually the exact problem we built something for. If you're sitting there realizing your dog has shown 2 or 3 of these, and you're not sure which one to bring up first or how urgent any of it really is, we put together a free 2-minute quiz that takes everything you've noticed, the limp, the appetite, the energy, all of it, and maps it into your own dog's bigger picture, then shows you where to actually start. It doesn't diagnose anything, and it isn't a replacement for your vet. Your vet is still where any real answer comes from, but it's a fast way to organize what you're seeing before that visit, instead of walking in with a vague feeling and a half memory. The link is in the pinned comment, or you can scan the QR code on the screen. Take it after this, though, because the sign that matters most on this entire list is still ahead. A sore that won't heal is easy to dismiss because dogs get scrapes constantly. A scratch from the yard, a rub spot from a collar, and normally those close up within a week or two on their own, scabbing over and fading without much thought from anyone. What's worth flagging is a sore that's been open longer than about 3 weeks, one that keeps reopening after it seems to scab, or one that looks more like an ulcer than a scratch. Cancer can interfere with local blood flow and the skin's own repair process right at that spot, which is part of why the area simply refuses to close the way ordinary skin does. It's not something to treat at home with more ointment and more waiting. It's something a vet needs to look at directly, because the treatment for a sore like that depends entirely on what's actually going on underneath it. And it's worth saying, a sore that won't heal isn't automatically cancer either. Some just get irritated by constant licking and need a cone and a little patience, but that's a call for your vet to make, not a guess from across the living room. Now, the one most owners never see coming: strong breath with blood. Dog breath was never going to win any awards. That part's just true, and nobody's pretending otherwise. What's different is breath that turns sharp, metallic, or foul in a way that's new, especially paired with blood in the saliva, a nosebleed with no obvious cause, or gums that bleed without an injury behind it. A tumor growing in the mouth, the nasal passage, or the throat can erode nearby tissue and blood vessels as it grows, and that's what produces this particular combination, not just bad breath, but breath and blood together, showing up at the same time. This is the one sign on this list that moves past watch and wait into see a vet now territory, and it's worth being direct about that instead of softening it. Active bleeding that won't stop, gums that look pale, white, or bluish instead of pink, labored or noisy breathing, sudden collapse, a belly that looks swollen and firm, or repeated vomiting alongside weakness. Those are reasons to call an emergency vet the same day, not next week, not after trying something from a cabinet first. Nothing you do at home replaces that call, and no home remedy, no supplement, no detox is going to treat what's actually causing it. Early professional evaluation is the only thing that genuinely changes the outcome here, and that's not a sales pitch. It's just the honest shape of how this works. For the 6 signs before that one, the ones that live more in the watch closely category than the call now category, the plan is simple, and it doesn't ask much of you. Once a month, weigh him and glance at any lumps against that same coin for scale. Once a week, jot down 2 lines in your phone. How's his energy? How's his appetite? Nothing fancy. If your dog is 7 or older, ask your vet about adding a senior wellness panel to his regular checkup. Blood work that can flag internal changes well before anything shows up on the outside. None of this is treatment, and none of it is a diagnosis. It's just a way of handing your vet a clearer picture instead of a vague memory. And that clarity alone is often what gets something caught while it's still small and still very treatable. One more thing worth holding on to. If your vet checks a lump or a limp and it comes back as nothing to worry about, that's genuinely good news. But it isn't a reason to stop watching. Bodies change, and something that was fine in spring can look different by fall, which is exactly why the monthly weigh-in and the photo habit work best as an ongoing rhythm, rather than a one-time check you do and forget. Small and steady beats thorough and rare every time, because the whole goal here is catching a shift while it's still small enough to be a simple fix instead of a hard one. None of these 7 signs on their own means the worst. Most of the time, a slower dog is just a dog who's living a full, ordinary senior life, and most lumps really are nothing. But now you know the shape of the ones that aren't just age, the mismatch, the change that doesn't fade evenly with everything else. And that's the entire difference between catching something early and finding out about it too late to have many options left. None of this asks you to become anxious about every nap or every scratch. That's not the goal here, and it never was. It just asks you to know your own dog well enough to notice when the pattern breaks, and to treat that break as a reason to call, rather than a reason to wait another month and see. If this changed how you're going to look at your own dog this week, go ahead and subscribe, and that free 2-minute quiz is still sitting there in the pinned comment or the QR code on screen whenever you're ready for it. So tell me in the comments, how old is your dog right now? Just drop the number, because it'll tell you a lot about which of these 7 is worth watching closest for him. Then go find him wherever he's curled up right now, rest a hand on his side, and just feel him breathe for a second. That's really the whole point of paying this much attention in the first place.